Week 3, whoa, that is loud, Dawson. Okay, there we go. Week 3, you survived. How's everybody doing? So, for those of you who are new, typically we announce things that are coming up so you can get recital attendance. There's nothing soon. Tomorrow night, marching band has a big fundraiser event. If you want to go to that and you don't have a ticket, because tickets are $50, we can give you a free ticket. To be honest, we haven't sold very many suites, so we're trying to put people in there. So if you want to go, talk to me or Jenny, and we'll get you on a list, and you can go. But we would like to have a crowd for this event. So the only other thing coming up is then 2 more weeks is Choral Collage is the first big concert. So that's on Friday night, September 27th. But between now and then, there's not much going on. Anything off campus anybody wants to announce? Yeah. Dr. Kovacs talked about that last week. So, but the first round of auditions for that are November 1st, right? So, again, talk to your applied professor if you want to do that. But I do encourage you to consider auditioning for the concerto competition. Anything else? Football is Saturday, second home game. Those of you who are not sports fans, which includes me, I do still encourage you to go see the marching band. You know, you can roll in during second quarter, watch the halftime show, you're good to go. But you get free student tickets to football games. Nothing else? Okay, we're all boring today. All right, so this is our first actual guest of the semester, and here to talk about something that's really, really important for all of us. And I'm going to let her tell you more about her background, but please welcome Dr. Kimberly Masker.
First question is, can you guys hear me okay? We have a brand new microphone that we're testing out today. So if I cut in and out, that was happening earlier, I'm going to make sure I talk loud so that you can still hear me. But like I said, I'm actually a professor in the occupational therapy department that's over on the VA campus. And how many of you have ever actually heard of occupational therapy? Oh, good. Way more than I thought. So OTs we're part of that triad. You have PTs and you have speech therapists. And OTs, our foundation is based in what occupation means is just anything that is important to you to be able to do in your day. Any occupation that you need to do during the day. So we're not finding you jobs. We're actually looking at all the things that are really important to your occupational performance during the day. So that can be anything from getting up, getting ready in the morning, school, play, leisure tasks, can do work skills sometimes. It just depends on what's important to that person and what we need to work on. So we see people kind of across all different settings. But I'm going to talk to you guys a little bit today about my specialty, one of my specialties, which is actually musician's medicine. So it's something that I've practiced in and specialized in for the last several years and something I'm very passionate about. And I'm very excited to be teaching here now and being able to have kind of a connection with you guys. But I'm going to talk to you guys about a few things today. So I just want to give you a little bit of just quick background on where musician's medicine kind of came from, because we do have writings all the way back in the 1800s where musicians were talking about things that were going on with their bodies, and where we are now, and kind of what the resources are out there for you guys if you do start to have some problems. But we're also going to talk about what do musicians' injuries look like, even across kind of the population of different types of musicians. And we're going to talk about risk factors, and then we're going to talk about things that we might do. But the biggest thing we're going to talk about today is prevention and kind of healthy practice and play. What can you guys do to make your careers as long-term as possible and feeling as good as possible? So what is it that makes me a good person to come and talk to you guys? Full disclosure, I am not a musician. I play a little piano, I play a little hammer dulcimer, probably not something you want to sit down and listen to. But I have a joke that my whole family is vocalists and musicians, from the youngest all the way to the oldest. And I always say God messed up a little bit, and he put me in the medical instead of the musical category. But what I've found in my specialty is that as an OT and with the background that I have a really good knack for looking at the person as a whole, looking at how they move, looking at what's going on in their daily life, finding those patterns, movement patterns, activity patterns that are causing problems. And then also, when there is a problem that needs to be treated, whether it's a tendonitis or a nerve compression or something else, I have that ability to kind of pick apart. So we're not just going to treat that injury, but we're also going to figure out what caused that. Because usually by the time you have a problem, there's been something else going on for quite a while. So that is one of the things that, like I said, I've specialized in quite a while. I have a certificate in the Essentials of Performing Arts Medicine from the Performing Arts Medicine Association. If you've never heard of that, I definitely recommend you look into it. If for nothing else, if in the future you do have problems, there is a directory of medical professionals there, from doctors all the way down to therapists, counselors, all kinds of different professions that are there to help you, and across all of the performing arts. So it's instrumental, vocalists, actors, dancers, they have it kind of all the way across the performing arts world. There's even specialists in there for circus performers. So there's a lot of specialists that are available for you. My clinical practice, even though I teach here, I still work at the Hand Center at Bristol Regional Medical Center, and that's where I tend to see most of my musicians, unless we're kind of doing kind of off the books consultations. So that kind of tells you why I'm here to talk to you guys. So the first thing I want to do is ask you guys a couple of questions, but I want you to be able to feel that you can answer them kind of anonymously. Because sometimes, and we'll talk about, sometimes things that go on with musicians are things that we don't want to talk about a lot for different reasons, and we'll kind of get into those reasons. But I want everybody to close your eyes for me. No peeking. Nobody's taking roll, so please feel free to be honest about what's going on. How many of you have had a time in your life when you've had a minor ache or pain or tightness related to your play or performance? How many of you have had a more major physical problem related to your play or performance? How many of you have had stress or anxiety related to your play or performance? And how many of you had some kind of symptoms right this minute? So, you guys can open your eyes. So, not surprisingly, the majority of you guys raised your hands on almost every question. And that is what I tend to see. But it's not talked about that much. And sometimes it's hard for musicians to find the resources that they actually need. Sometimes it's hard to talk to each other about it, depending on what's going on. So we're going to talk about how we can change that framework just a little bit. So let's kind of go back in history a little bit. So how many people know who Alexander Scriabin was? Pianist should know. He was a Russian pianist in the 1800s. Known to be very eclectic. His last, I think, unfinished symphony was Mysterium, and it was very kind of atonal and dissonant. But what he had done is he wanted to give every tone in that symphony either a sense, a smell, or a touch, or a taste, because he wanted to give his audience a whole sensual experience. But what's interesting about him is that he had an injury as a student in his right hand. And so he talked about how he wanted to learn this particular piece of music. It was a Russian piece of music, and he practiced it all summer long, just to the point almost of frenzy. Has anybody in here ever done that before? Tried to kind of over-practice, frenzy, learn a new piece, and then kind of paid for it a little bit later. What happened with him, though, is he ended up with some sort of permanent injury in that hand. And we don't know for sure from the writings, and there weren't a lot of doctors back then who could recognize it, but my assumption is he had something like a focal dystonia, because just the tendonitis probably would have kind of eased up over time, but that is something that can last longer over time. So if you look at some of his writings, they actually really favor his, quote, good hand, or they avoid that hand altogether. And so that's one of the first things that we see talking about these musicians' injuries. And then Robert Schumann also had some sort of palsy or disorder in his hand that affected him over time. And he talked about that how things, too much writing, too much playing. You know, back then, we didn't have a lot of computer programs. Everything was handwritten. I know we still do that some now, but computers have been good and bad at helping us with that. But it's just kind of looking back and seeing that these things were there. The problem was no one was really addressing them or knew how to address them. So why is it really important that we talk about this? So the Bureau of Labor Statistics says that there's 34,000 professional musicians, and that just professional to them just means full-time, and that's instrumentalists and vocalists employed in the United States. But do we feel like that's really representative of how many musicians there are in the United States? Not even close, because we have a lot of people that might not classify themselves as a full-time professional musician. It doesn't mean that they're not a musician. It doesn't mean that they're not playing enough or practicing enough, performing enough to have these problems. So we have people that are working off the books, people that are doing gig jobs, people that are self-employed and maybe kind of stay under the table a little bit with that stuff. So there's a lot of people that have these problems that we're looking at. And if we look at Tennessee in particular, the Nashville metro area, they say there's 1,230 professional musicians. Does that sound reasonable for the Nashville area? So we know that those numbers are probably not completely accurate, but that's actually what gets looked at when they're looking at what medical needs are for different professions. And so if that's very underrepresented, it can make it a little bit more difficult to see that those needs are out there. So that's something we have to look at. And then looking here in particular, if we look at numbers for East Tennessee, we're the second in the nation for employment level and highest concentration of musicians among non-metropolitan areas. And we all know that, but again, kind of underrepresented, so something that needs to be looked at a little bit more holistically. The medical community didn't really start looking at musicians' medicine closely until around the 80s. So that's when actually the Performing Arts Medicine Association was established, and that's because there were all these groups of medical professionals that were seeing musicians and felt like there needed to be a repository, a place to all come together. So they have a conference every year that's an amazing conference. They have speakers from all over the world talking about all aspects of performing arts medicine. And so they're a really good research study. But the reason we need to look at that is when we look at studies, they can range that, they say that anywhere between 54 to 90% of musicians report that they have had some sort of play-related or performance-related injury. So we have a very large number, but that also seems like kind of a very odd range. So let's talk a little bit about why that is. Because you can have one orchestra that may say 70%, 76% of their members have this many, and another says that only 40% have that. So we want to look a little bit about why that difference is. So there's a couple of things that we look at. One is that there's a low percentage of reporting. That's one of the biggest reasons, I think, and there's a lot of reasons for that. One is a lot of professional musicians tend to not have health insurance. So they may be kind of self-treating or doing other kind of alternative treatments versus going to a physician or another medical professional that might show up in a more formal survey-taking method. There's also lack of time for treatment. You guys are very busy. You're practicing all the time. You have a lot of things that you're preparing for. So a lot of times it's really hard to take that time out of your day and your practice schedule to try to get help for some of these things. For a long time, musicians' injuries weren't considered work injuries. So a lot of professional musicians didn't know that they had rights when it came to workman's comp and things like that. So that's something that we're also trying to change for people that are professionally employed, like with orchestras and different things. Those things are out there, but it's not well established for them that they have those things for them. And then there's also those perceptions. It's like, how is my injury going to be perceived? You guys are just like athletes, which we'll talk about more. An athlete does not want to say that they have an injury because they could lose their job. They could be perceived more differently by their teammates, by their the other musicians in their circle. So there's always kind of been a little bit of a stigma to injury too, which has kept people from reporting that. So that's something else that we want to try to change for you guys. But also, us as healthcare professionals can also be an issue. There is a very accomplished musician named Christine Guptill in Canada, and she is also an occupational therapist, and she's very, very involved in the performing arts medicine world. But she did a very extensive qualitative study with musicians looking at their perceptions of their life as an injured, what their experience as an injured musician was. It was really interesting because what she found was that they have this lived experience, and it's in this context. So they have all these roles, a musician, teacher, worker, but they also have all their lived experiences around that. So they have their lived time, their lived space, their lived social relations, and their lived body. But she put that all within the context of the healthcare system, because the healthcare system can have such, in a lot of cases, unfortunately, a negative connotation for them, sometimes positive, but usually negative. So we're looking at this experience of an injured musician within the context of the healthcare system itself. And so a lot of people had really negative experiences with the healthcare system. How many people have gone to see a physician or someone for pain that they were having and were told to just stop playing? That's not very reasonable for you guys, is it? There needs to be other ways to address these things. So that's one of the things kind of that came across a lot, is that they were very frustrated with that feeling that they were just being told to stop. So one of the things I want to do as a member of the healthcare world is try to kind of be an affront to this and change the access for you guys and change the stigma of having these injuries and change availability and knowledge for you guys of where to get help when you need it. So we talked a lot about professional musicians, but what about younger musicians? So starting even as children, there's a big study that showed that child and adolescent musicians were having almost the same rate of injuries in a particular clinic, from as low as 30% to almost up to 60%. In another study, more than 80% of student musicians presented, and what was concerning with them is they were having bilateral problems, so meaning both sides. So they were having problems with both arms or hands, or they were having more central problems with neck and trunk, or the vocalists were having trouble kind of with the entire vocal mechanism already at these young ages. And so there's a big push to kind of get musicians at a lot younger age. And then for you guys, for university students, their ranges are kind of all over the place, just depending on where the study was done. But between 25 to more than 85% of university musicians have reported that they have some sort of injury. And we definitely were going more towards the 85% today when you guys had your eyes closed. So we're seeing that play out today, and that's something that we want to look at. You guys are athletes. As a medical professional treating musicians, and the whole Performing Arts Medicine Association feels this way, you guys are athletes. You guys both have a lot of the same characteristics to what you're doing every day. You practice or perform nearly every day. You play through pain. You perform at all times of the day or night. You practice at all times of the day or night. You compete and perform in very challenging environments, and that can be challenging just stressful-wise, or it can be challenging meaning you're in a really small space and you can't move the way you need to play, or it's very smoky, or it's very hot, or it's very cold. So you have a lot of different things that you have to play in, just like athletes do. You have a very brief, if any, off-season. I don't know many musicians at all that really have an off-season. You have a lot of pressure to succeed. I think of any other profession compared to athletes, you guys have as much or more pressure to succeed than they do. You push your bodies, and you face a real risk of career-ending injury if we don't kind of catch these things early on and manage them. Just looking at some comparisons. In a Major League Baseball game, there's 150 pitches per game. There's 8,000 steps per player in a soccer match. There's 30,000 steps in a marathon. There are 30,000 notes in Rachmaninoff's Third Piano Concerto, and those are done over a short period of 45 minutes. There are NCAA athletes, they have regulations. They're only allowed to practice 20 hours a week of team practice. You guys practice 4 to 8 hours a day, so more than 40 hours a week, right? So you guys have, I said when looking at the differences between you guys, they're not that different. What is different with musicians a lot of time and with vocalists is that the muscles we're dealing with sometimes are a lot smaller and a lot more prone to injury, especially with repetitive use. So I think looking at you guys as athletes is what we have to do to be able to understand the framework that we need to work with you in. Other things that affect you guys is there's a lot of traditions in the performing arts. A lot of you started very young. A lot of you have the mindset that the teacher is the authority. And that's true, but there are also sometimes even the people in here that want to be instructors. That's something to think about, is kind of even changing the mindset for you. It's like, how do I want to look a little bit differently at these students that I'm going to be teaching so that I can help make a positive difference here? You have auditions and touring. You have a no pain, no gain mindset, again, pushing through that pain. You have a tendency to try to hide injuries, and you have limited access, especially around here. In bigger cities, it's a lot easier. If you're somewhere like in New York City where they have Juilliard that has a whole performing arts medicine department dedicated to them, then they have a lot more resources and they know they're there. But we have a lot less in this area, and that's something, again, we hope that we can change over time. But even with that, we want to be able to get you where you need to be able to be. Our vocalists also have really specific risk factors. Those accessory muscles of your neck, when you start to have vocal fatigue or injury, you also start to have compensatory motions in your neck. So things start to get very tense, and that starts to affect the whole upper trunk, and then actually it can start to affect lower trunk and the rest of your body as well, on top of causing even more damage to the vocal mechanism because things aren't able to work as freely as they need to. You guys kind of have some extra levels of fatigue with your voices, and you have things that do affect instrumental musicians, but also can be a little more impactful for a vocalist, like some certain illnesses. If we have a sore throat, that's definitely is going to affect a vocalist more than it's going to affect an instrumentalist. Hormonal changes change our voice a lot and makes us a lot more at risk for certain things happening. And then having just trauma, and then our postural changes can affect our vocalists as well. Everybody still with me? All right, so we're going to look at this funny little cartoon here. Has anybody ever told you guys that your brains are different? Your brains are literally different. You don't just think differently. Your brains are actually mapped differently, which is a good thing for what you do. But it can also make you a little bit more prone to having issues with pain over time. So this cartoon is called a homunculus. And what this is showing is the somatosensory cortex of the brain. And the reason it's kind of a funny looking cartoon is the areas of the body that have the most representation neural-wise, so that have the most concentration of the brain that are attributed to control of those parts, you can see are the lips, the gums, the tongue, the face, and the hands and the fingers. So what that means is that you have a greater part of your brain that is dedicated to those parts. But you guys that started, especially if you started really young, when our brain was able to really remap, it's a little bit harder when we start as adults, you have an even more specialized part of your brain for those body parts. And so those brain parts are already very hyper aware of any sensory changes. So when you have something that causes pain, your brain is also very hyper aware of pain. And it's very hyper aware of what it's going to do with that pain and what it's causing as a kind of a sympathetic fight or flight reaction in the rest of your body. So musicians can be more prone to chronic pain. So that's another reason that we really want to catch pain early and as soon, and even hopefully before it becomes pain. We want to catch you guys when we're starting to see some of those early symptoms that we'll talk about. These are some of the biggest things that I see in my clinic with my patients. So repetitive motion and overuse injuries. So whether that's just tightness, whether that's things like trigger fingers, tendonitis, different things that kind of cause, you know what trigger fingers is? You make a fist and one kind of sticks and you have to kind of pop it out. That's a kind of tendonitis or tendinosis in the tendons of the finger. Can be very common in string players and keyboards as well. Mental health issues, so performance anxiety, which can impact all of these other things that we're looking at. We see effects of other medical illnesses on their performance. So I may see someone that they're diabetic, so they're already having some issues with their tissues, which makes their tissues a little more fibrotic and just a little bit more prone to some of these overuse injuries. Looking at effective travel on your performance, and that can be the stress of travel. That can be having to haul your equipment or your instruments. It can be just having to carry a suitcase, on top of everything else. So there's a lot of effects that we'll see with that. So it's kind of more of a holistic thing that we're looking at. The other big thing I see is nerve entrapments. A lot of nerve tension, a lot of peripheral neuropathy. So when you get that numbness and that tingling in your hands, we're going to see quite a bit of those. Thoracic outlet is when the nerves in the thoracic outlet that's in between your neck and your shoulder are very compressed. And so you can imagine some instruments cause a lot of compression there. So it's something that we can see as a problem. But also positioning can do that as well. Focal dystonia, that's when there's actually a nerve, kind of an abnormal nerve response that causes a muscle to cramp. And it's not like a normal, like Charlie horse cramp. It's a cramp that kind of doesn't stop, and it happens when you try to do, usually there's a very specific motion that you're trying to do, and it goes into kind of this kind of spasmy. And for a lot of musicians, unfortunately, it's certain things that they're doing with their hands. Also, vocalists get this in their vocal cords as well. So it's something, again, that we want to try to catch early on when there's these abnormal movement patterns to see if we can stop some of these things. And there's a couple other things that I wouldn't see as much, like hearing loss and skin and dental problems, but those, again, are things that need to be addressed on that end. What are the things that you guys need to pay attention to? One thing we'll talk about is prevention techniques, but these are the things we need to watch for. Hopefully, if we're in a preventive mindset, we're going to try to get to things before we get to this point. But as soon as you start feeling stiffness or tightness or tension in your muscles, it's time to try to look and see where is that coming from. As soon as you start to feel some fatigue, especially fatigue that's reducing your playing time, we need to look and see where is that coming from. As soon as you have pain or numbness or tingling, we need to address that as soon as possible. If you have swelling after you play or practice, or you're having tremors, even little kind of tremors that just last a second, those are things that we need to try to get to as soon as possible. And then weakness that you're feeling. So sometimes fatigue is when you start out okay, but you tire out. Weakness is when you just have actual muscle weakness and it's not doing what it needs to do as soon as you sit down and start to try to practice. So what can we do to help? We want to talk about your instrument care and maintenance. Your instrument is you. And so that's something that we want to look at. Again, we go back to our athlete framework. You want to start with, just like an athlete would, you want to do a warm-up before practice, before performance. Hopefully a lot of you already kind of have that built into your routines, but you definitely need that warm-up. You need to get at least 7.5 hours of sleep if you can. And I know that's kind of a joke when you're a student, but the reason is when we're asleep, that's when we heal. That's when our brain and our tissues get really oxygen perfused from all that rest and sleep. The brain kind of rewires and heals itself, and we need that time to recover from what we've done to ourselves during the day. We need good nutrition and hydration. Again, those tissues in our body need to be as healthy as possible. If we're not having those things, we're not going to be able to keep those tissues as healthy as they can be. Work on stability and mobility and flexibility, even when you're not getting ready to play. So exercising, walking, stretching, those kind of things need to be just part of your daily routine. Postural exercises, we'll talk about some different things that you can do, but really it's finding what works best for you. You need to vary your workout intensity. Just like an athlete might do HIIT training or an athlete might do kind of rotation training, you guys need to do a similar thing with your practice. Every day shouldn't look exactly the same. We need to do some modifications, some kind of rotation things so that you're not overstressing the same things day after day after day. Massage for your tight muscles, whether it's professional massage, self-massage, those things are very, very good to loosen up those tight, tense muscles. And then using heat and ice when you need to. When you're starting, especially if you are already kind of tense before a play, if you can kind of warm up, that will help you get started with that. We talked a little bit already about anxiety and stress, but I want to talk about a couple of things just really in particular. One is thinking about your diet. Think about foods that are inflammatory, and that's something that you can look up. But when you're eating foods that have a very inflammatory component to them, they make your tissues inflamed. They make your blood vessels inflamed. And so inflamed tissues and blood vessels and nerves do not respond well to overstress. So kind of watching that diet, it's fine to do some things in moderation, but if you're eating a lot of inflammatory foods every day, that can definitely have an impact. The other thing is caffeine and nicotine. The oxygen in our bloodstream is a food for our tissues, and we have binders on our red blood cells, so where the oxygen attaches to. The problem is the nicotine and caffeine molecules can bind themselves to those oxygen binders. So they can actually take the seat on the bus from the oxygen, making less oxygen into our bloodstream, less into our tissues. So you're basically starving your tissues if you're using a lot of nicotine and caffeine. Now your little, coffee in the morning here and there is not a problem, but if you're drinking caffeine all day long, or especially if you're dealing with an injury, sometimes that's something that you want to look at a little bit closer. And then looking at things that sometimes we can and can't do anything about. Sometimes we're in those places, like I said, they're smoky, or there's a lot of vibration, or there's just not much room to move around. And so those are things that we can look at. How can we adapt for that before and after? How can we help ourselves recover from that? What techniques can we make to help ourselves kind of be able to adapt for that? Whether it's being able to kind of get up and change position, do a lot more stretch breaks while you're playing if you're in one of those settings where you can't move, getting out where you can get some oxygen. Even if it's kind of scheduling a couple more little play breaks, say you're doing a set somewhere, if you can have a couple more breaks or have them try to figure out some sort of ventilation system for while you're playing. One of the other things I really think about when I'm treating my musicians, that you guys, your instruments are actually an extension of your body. Your vocalist, you're actually carrying your instrument with you all the time. But if I'm having one of my violinists or a guitarist or a drummer, they're really telling me that they stop realizing where that instrument ends and their body starts. So we start to lose some body awareness. We're not really paying a lot of attention to what's going on. We're paying attention to what it sounds like, what we're feeling through the strings or the keys, but we're not really paying a lot of attention to what our body is telling us. And so that body awareness is really important to develop. What do we mean by body awareness? Dr. Woodman was an analytical psychologist, but she did a lot of research on body awareness. And I like this quote because I think it explains the concept that I'm trying to get through to you guys. I think you can take anything in your life and replace that word cat, with the word instrument, or the word your voice, and put it in the place of cat. You know your instrument intimately, right? So you wouldn't leave it out in the rain. You wouldn't leave it in a really hot environment. You're going to avoid that. You're going to take care of that as much as possible. We need to treat our bodies the same way. So if we kind of cherish our bodies, they're going to respond in kind to us. Unfortunately, usually by the time a musician comes to see me, they're already having that earth-shattering scream. So what I want you guys to learn is that we need to listen for that whisper, that little pss, pss, pss in your ear that's telling you something's not quite right. Don't wait for the earth-shattering scream, because I promise it's a lot easier to deal with that whisper than it is to deal with the scream later. It's a lot harder to kind of turn that process around. But that's the meaning of body awareness, is learning to be aware of our bodies, learning to feel what we're feeling, feel what might be an issue. So there's a lot of ways that you can do that. Even like breathing and mindfulness apps. It's a nice thing for you guys. There's so many apps out there now that are available to help with this. But there are other things that you guys also have access to. You have an Alexander Technique course here on campus. It's been studied with musicians almost more extensively than any other diagnosis. There's Alexander Technique books out there for everything under the sun, tennis, every sport you can think of. But there's also good ones out there for musicians in general, and there's Alexander Techniques just for certain instruments and just for vocalists. So there are a lot of things out there that are available to you guys. So I encourage you to look at that. But what Alexander Technique is it's looking at the use of self. So learning to use, organizing our focus and our attention, and then also looking at how are we going to react to certain situations. So learning when we need to react and how we need to react. They're going to look a lot at posture, movement patterns, and ways that we can help with that. And I'm not an AT practitioner, but I do use a lot of their concepts in my own treatment. Again, it's looking at those kind of whole body movement patterns and how we can change that. Breathing and breath work. I know my vocalists do that. Do any of our instrumentalists do that? Good. I see that more and more. That's starting to definitely be something. It's something I didn't see as much in instrumentalists for a long time, but I'm seeing it more. And I think it's because breathing and breath work has just kind of become so much a part of our vernacular in that kind of mindfulness realm. So I am seeing a lot of people that's helping with. But there are a ton of studies that show how diaphragmatic breathing, deep breathing exercises can help with pre-performance anxiety, during performance anxiety, and can help with a lot of things, like if we're having kind of that racing heart rate, which over time can definitely be detrimental to our bodies. But diaphragmatic breathing is used in a lot of different ways. Through therapy, we use it in pulmonary rehab. But the reason is that it's so beneficial to reperfuse our body with oxygen, again, to bring our heart rate down, help that stress and anxiety of the entire body. And it also just helps us. We learned good diaphragmatic breathing. We're going to decrease the effort that it takes to do the things that we need to do every day. So since you guys already know that pretty well, we're not going to go through this today just to make sure we can kind of get through everything else today. But this is something I do encourage you, if you're not doing, to start kind of making a daily practice. So when I'm looking, the other thing that I'm really looking at with my patients, or if someone's coming to see me for a consult, is are we playing smart? So a lot of times I'm trying to have x-ray vision, and a lot of times I will see my musicians as they play or perform. So I'm trying to have x-ray vision and see all these structures that I know that are underneath the skin. I'm thinking about what they're doing while you're playing, and I'm looking for where are our problem areas going to be. So Safonov of the Russian Piano School, he was very good at this, even way back when, for his piano students. And so it's something I think is embedded a bit, but I think sometimes things that we lose sight of, things that we know we need to be watching. But he was very focused on technique, and he talked about that a lot in the literature. And his techniques were very ergonomically sound. He talked a lot about seating, and he talked a lot about posture. And he felt that the problems with thumb, for pianos in particular, the thumb's kind of the keystone, and if we don't have a healthy, well-playing thumb, it can affect the whole rest of the extremity. If we're not paying attention to posture and seating while we're playing, it can affect the whole rest of the extremity. And so the other thing he kind of introduced or talked about a lot was that tenodesis. Once you push that key, we should have that kind of nice fluid motion where the wrist comes back and the fingers relax, versus having a very tense hand when we're playing. I always see my musicians with their instrument. Again, like I said, I just want to try to get a handle on what it is that's going on with them, and not just dealing with the problem that they may be having at the time, but looking at where things that we might need to adjust that might have led to this problem in the first place. So we're going to try to find the original source of the problem. And so we're going to look at the physical aspect of the play, like with the guitarist, what are their hands and arms doing, but I'm also gonna look at how are they sitting, how is the rest of their body moving or not moving when they're playing. I take a lot of pictures and videos, and I'll refer back to those, and then we'll use them later to kind of compare and contrast to what we're doing. But I'm also looking for things like hypermobility and things like muscle imbalance. So with this young lady, she does have a lot of hypermobility in her fingers, and it changes the way that she places her fingers on the strings. And she was having a lot of proximal shoulder issues because of the playing technique. And so there were some simple things that we did for her. Just kind of adding some hypermobility rings, that's the little silver things there, just to help her be a little bit more controlled. It just keeps, so her fingers were the kind of fingers that they kind of really hyperextend the PIP joints, the middle joint. She was one of those people that kind of make her fingers go backwards. But it meant she didn't have really good control of the strings because her fingers were unbalanced when she tried to play. So very simple little silver ring splints actually helped kind of her keep that in a better place. There are other things I might look at. If I have a patient with arthritis, like my violinist, has a really bad thumb arthritis, we can do some things to stabilize that thumb so that they can keep playing. We have somebody that's having some issues with wrists. This young man had some hypermobility in his wrists. We're kind of specializing that because I didn't want to put a hard splint on him because he would fight it. So you get a lot of micro trauma. So we're going to do something that's a little softer, more neoprene that gives him some support but doesn't limit his play, because that's kind of number one for me. It's like I don't want to do anything that hinders your play or performance ability. We need to look, yes, we need to look at what's going on and see what we can modify and change, but there are some things that we need. Our ultimate goal is to keep you playing. There's a lot of other little tools that we use, things that you guys have available to you that you don't have to see a specialist for, things like posture shirts. There's even like white performance dress shirts that already have that posture mechanism built into them. That's kind of very popular among especially male orchestral musicians, and just helps you kind of maintain that posture, which is one of the big things we talk about. So there's a lot of modifications we can do. You guys probably have some modifications on your instruments, whether it's like a chin rest on a violin that just keeps you from having such a depressed head posture and keeps your neck in a little bit better posture. There's a lot of different things out there that we can do. So that's something else we often do, is work with your instructor or your teacher and look at things that we can change. Sometimes it's just a factor of the instrument is too big or too small for that person, or it didn't get changed as they grew. So sometimes it's just looking at, is that something as simple as that we need to change? There's no cookie cutter. But I'm also going to look at all the other things that you do during the day, especially you guys, school and computer habits. What do your work and sleep postures look like? How many of you look like this guy at night when you go home? How many of you look like that lady when you're on your computer? What I want you to think about, when our head is like that, every inch that our head moves forward from midline, we're adding 10 pounds to how heavy our head weighs. So if your head is down where hers is, your head weighs about 40 pounds. So your neck muscles are trying to hold that up, and so they're hyper-contracted and tense. And so we're causing a lot of compensatory problems that can be big issues. So really looking at changing computer postures, getting yourselves in better ergonomic positions, trying to stay out of these different maladaptive positions can help you, not just with computer, but also with play. It's also the same sort of things we want to look at. It's like, how can we work on posture during play as well? The same ergonomic principles are going to apply. And then those things other things we do, kind of on top of those things we like to do, like gaming, being on our phones or our tablets, going out, playing darts at the bar at night, just anything that's kind of very repetitive. With our hands, we also need to look and see if those are having some sort of effect. Because the same muscles that get affected when you play are also being used, and these, again, are these really small intrinsic muscles that are very prone to injury and very easy to overuse. One of the big things I teach my patients is there's two 20-20 rules. The first one is For every 20 minutes that you're doing an activity, whatever it is, if it's something repetitive, the same thing over and over again, you need to stop every 20 minutes and stop and stretch for 20 seconds. You don't have to take a long break. It's just that 20 minutes is kind of a good timeline. If you wait until you're really tense, you just can't play anymore, it's really fatigued, we're already in the damage realm. So that 20 seconds is not a long time to kind of sit up, stretch, move the things in different directions from where they've been moving. If you're on a computer or you're sitting where you're having to really stare at music, we're going to throw that other 20 in there, which is every 20 minutes, we need to take our eyes off the screen or off that sheet of music, look 20 feet away, and kind of move our eyes around. Because again, that's going to give us that opportunity to kind of have that quick recovery versus waiting until something is just overbearing and something that's a lot harder to get past. We talked about earlier, I was talking about Scriabin. When he was having his the first initial part of his injury and he was trying to get back into play when he was a younger therapist, he was working on a Franz Liszt opera called The Reminiscence to Don Juan. And that's what he was working on, frantically trying to learn. And so when he went to his teacher, who was Safanoff, that we talked about, he told him that he wanted to work on some lighter pieces to start to gradually, and he said he was trying to help relieve his indigestion from Don Juan's spices. So he was giving him what I would talk to my patient about, especially someone that had more of a traumatic injury or a surgery, but even someone that's had a pretty traumatic play-related injury where they've been very affected. We're going to use some sort of play schedule, and it might look like this. It might be more modified to help you gradually build that tolerance back up. It's just like if you have an injury, you're not going to go back to the gym and lift 100 pounds. You're going to start a little bit lower, maybe a few more reps, but lower weight, and work yourself back up. And so again, this is something we might work with your teacher to kind of help develop the best way to move this forward. So the last thing I just want to mention is that there is a project out there called the Health Promotions in Schools of Music Project, and it is something that I've been involved in, and it's something some of my graduate work came out of. But it is a recommendation that we start getting students like you guys, and even younger, as young as possible, starting to develop this health promotion framework, which again is kind of why I'm here, to get you guys to start thinking about these things. There's recommendations to start looking at formal courses for music students. And schools that have established this are seeing really good results in the amount of injuries that looking at, there are prior classes that didn't have access to this, and then looking at the ones that did, those injury rates before and after. And people were coming out of school with a lot less incidences of these play-related injuries. So my biggest takeaways for you guys that I want you to have today is that you take care of your physical instrument. I want you to take care of your literal instrument just like you do your physical instrument, and vice versa. Think about your body. It's just as important as the instrument that you play. Okay? For our vocalists, think about the rest of your body. It's just as important as taking care of that vocal mechanism. Don't wait for those little whispers to become big screams, and seek specialized advice when you need it. Whether that's with your instructors, whether it's with performing arts medicine specialists. Again, there's directories for that on the Performing Arts Medicine Association. It's something I can help you guys with if that's ever something that you need help finding resources. And always be supportive of each other and your journeys. Again, one of the biggest things we have to break is that stigma about talking about this, talking about an injury. So talking to each other about it, being supportive with each other is really important at helping us move forward with that. I have a lot of resources for you guys, and they're actually all in this QR code, so my references, and also just a lot of different apps and books that are great resources for you guys. And so this is something that you guys can have back to refer to. But you will also, on the last slide, I have my email as well. So I always welcome questions. If you guys have you need anything, you want recommendations on stretches, you want resources, please reach out to me, because I can help with that. I'm always happy to have as many emails. Any questions? Yes, it can be. I see carpal tunnel quite a bit in musicians. That's one of those neuropathies, and it's very common in a lot of, especially strings and keys, but in others as well. The thing, like just like I said, with carpal tunnel, a lot of times that was kind of the last straw. There was something else that was causing you to move your hands and wrists differently because of a lot of times what's happening here. I talk to my patients about the crane metaphor. It's like if you think about, you have this little car that's kind of falling off into the bay, and they bring this little teeny tiny crane in, and it's got a very weak arm, and it's trying to pull that up, and the whole thing's gonna come over. But if we pull the big guy in, the big crane, he's kind of big and bulky and strong in that central core, and that's in the shoulder girdle, the trunk, and he can pull that car up and hold it. So always looking at those things, I'm always gonna look proximal, because a lot of times the things we're seeing out here are actually, they started up here, so we can't just address this part. We're gonna do both. Anybody else? If you think of any later, please email me. I've enjoyed talking to you guys today very much. Oh, sorry.
Is there any discernible difference between just regular uncomfort or regular pain and something that we should probably get looked at or talk to a professional about?
What I always tell my patients, especially if I can get musicians early on, it's like as soon as you start to feel something that just doesn't feel like it normally does, you're feeling a lot of tension, you're feeling a lot of fatigue after you play that you didn't have before, you're feeling a lot of tension in muscles, it's kind of taking your body longer to recover. That's ideally when you want to start to get to it, because your body movement patterns are going to start to change. So if you're having some kind of head and neck and shoulder stiffness in the trunk, you're going to start moving the rest of your body differently to make up for that. And so you can actually start to have multiple problems. So yes, obviously if you're having pain, it's definitely something that you want to address as soon as possible. But trying to catch these problems early on will help you guys extend the life of your music career for a lot longer.
On average, in your experience, how does the injury analysis work with the clinic?
Say that again.
Like on average, in your experience, how well the insurances work with the clinic?
How well does the insurance work with clinics? Yeah. It depends on the insurance for sure. In my experience, especially my patients that are coming because they already have a specific problem, usually not an issue with them. But a lot of times, the nice thing about the way the healthcare system's changing a little bit is if somebody's coming to me with, and we just have a diagnosis, kind of general diagnosis of arm pain or neck pain, it doesn't matter where it came from. I'm going to still be able to see you. So people that have insurance, that usually is going to be covered pretty well. The nice thing about Bristol, where I work, is because we're a nonprofit, we also have discounts for people that don't have insurance. So we already have some things in place to try to help with that, so the out-of-pocket expense is not as bad. So it's something that we're kind of very aware of. And again, like I said, sometimes I've actually, if it's just kind of like a quick little consult, I will see people sometimes just to kind of get a little screening of what's going on, and I'll tell you, well, I think you need to come in. Or this is something, I can give you something to try, see how it works. If it doesn't work, then we can move from there. You're welcome. Thank you guys very much for having me today.
Because we have the College of Medicine, the College of Pharmacy, the College of Health Sciences. We have so much medicine on campus. There are lots of resources. So we actually have a partnership with the speech and audiology department here. So Vocalist, if you ever want to get an endoscopy scope, they're willing to do that for you. The first step often is talk to your applied professors. I know for a fact almost all of us, all of the applied teachers have gone through some sort of issue that is similar, pain or whatever. So if you're experiencing what Dr. Masker was talking about, something where you get out of your lesson and you're exhausted, don't be afraid to tell your applied teacher that right away. Because sometimes you think, oh, I shouldn't tell them this because they're going to think I'm doing something wrong. They can help you sometimes just figure out, oh, there's a posture issue or how you're holding this, or you're not warmed up, vocalist, things like that. So first steps, talk to your applied teacher. If they can't figure it out, then definitely reach out. And Dr. Masker, I've only met her a little bit, but she's so easy to work with. We can help you find resources on campus or send you out. But again, the most important thing I got out of this is don't wait until it becomes a really big problem that you can't fix. So talk to someone early, even if you're a freshman and you're experiencing something. You may have developed a bunch of bad habits in high school, but start early. Thank you again.